Good afternoon, ladies and gentlemen. Welcome to participate UST Honorary Lecture on Research Integrity 2011. Today is an honor. We can invite Professor Leonardo, comes from Singapore University, to have us lecture for us. Professor Leo devotes to ethics integrity for a long time and have significant achievement. We believe today's lecture will be very fruitful and inspiring. Now, please welcome Professor Leo.
Yes, thank you very much, and good morning. How many of you here are members of institutional review boards? No. Okay. Okay. What I'm going to talk about this morning are some issues in the responsible conduct of research. And I hope you don't look at this as a lecture, but rather as an opportunity for us to interact and to discuss some of these issues. So I'll very much welcome questions as we go along the way. Okay? Let me see if I... Okay, let me begin by showing this quotation from C.P. Snow, which comes from his book entitled The Search. And he says in his book, the only ethical principle which has made science possible is that the truth shall be told all the time. The basic idea is that if we engage in scientific inquiry, obviously the whole point of everything that we do is to find out the truth. So that is a basic principle that gets us going. And therefore, if the primary principle is to tell the truth all the time or to discover the truth, then a false statement is the most serious crime a scientist can commit. Okay? Everything that the scientist does is founded on trust, okay, which is actually the root of science and scientific discovery. Okay? All of that should sound like a cliche at this time, but it seems that it is something that, although we take it for granted, many of us don't remember to observe all the time. And one of the things that we want to do, if we were to observe the truth or truthfulness, is to think of ways of teaching people to be ethical, people to be truthful. Sounds easy, doesn't it? Or maybe it sounds difficult, actually. During this article by Derek Bock. Derek Bock was formerly president of Harvard University in the United States. And he wrote an article during a time in the United States when there was a lot of controversy regarding truth-telling. This goes back to the time of Richard Nixon, who, as President of the United States, had to resign because of the Watergate scandal. And so there was a lot of discussion in the media and in academic circles about telling the truth, about the need to be truthful. And he raised this question in an article. And after raising the question, he proceeded to discuss some reasons why it is not so easy to teach ethics. So why have you been invited to come to a lecture about ethics and teaching ethics, and then you have someone telling you, oh, this isn't going to be easy? First of all, it doesn't seem to pay. Many people think, well, it doesn't pay, it doesn't work to be always telling the truth and to be teaching the truth, because for many people, it doesn't pay. It doesn't matter so much if you can hide your lies, if you don't have to be truthful all the time because there will be no bad consequences, then it should be okay. Is there a problem with this mic? No? And then there is the idea that if you teach people to be ethical, sometimes it gets in the way of research, meaning there are some research projects that are important that you need to do, but which you cannot do if you're too ethical. Sometimes you have to lie or you have to go against ethical principles, but we will take up some examples later on. Or sometimes it gets in the way of good results, because you have to be able to bring medicine to patients. You have to be able to do things that are good for the clients, and therefore, if you need to do that, sometimes you have to cut. Sometimes you have to cut corners, okay? If you want to bring about results, and if we're talking about medicine, then it is too bad if you cannot get the needed results pretty soon. And then there are those conflicts of interest. There are so many interests, so many things that we need or that we want that get us in different directions. They push us to move in different directions, and these directions are not necessarily ethical. But what am I talking about when I mention conflicts of interest? You would have heard about the phrase conflicts of interest. And what I'm going to do in the next few slides is to describe how researchers have shown conflicts of interest to work. What I'm referring to are some studies, empirical studies, about the way we get convinced to do certain things. And in the studies, what they have shown, for example, concerning physicians in particular, physicians who attend the grand rounds given by a pharmaceutical company are more likely to prescribe the company's drug, which is perhaps to be expected. But actually, that happens even if many of them do not recall what company sponsored the grand rounds. In other words, it works in a subconscious way. They don't remember who invited them to attend the grand rounds. They don't remember who paid for the food that was served. But just because that company was there, there is a tendency on the part of the physicians who attend to prescribe more of that company's drug. Okay? So you don't have to be trying to please the pharmaceutical company in order to do what they would want you to do. Okay? Do you get the point? Now, of course, if you were a physician, you'd think, well, but I am not actually affected by conflicts of interest. although you recognize that other physicians are affected by conflicts of interest in their decisions. Okay. So physicians generally would feel, oh no, it doesn't affect me, but I don't know about my friends, maybe it affects them. And what about the patients? The patients come to the rescue of their physicians, and they think other physicians are affected by conflicts of interest, but not my own physician. Okay. So these are empirical researches supporting these ideas. The research done by these social scientists come up with these conclusions or with these results. So self-interest actually results in biases and distorts the way that people weigh arguments. And even when people accept that they are biased, okay, so you realize sometimes, oh yes, I think I'm biased. But when you do realize that, the research shows you tend to underestimate how strong that bias could be. So you still think you're objective or just a little biased, but actually you are more than just a little biased when you think that way. And that happens even when the stakes are small. Meaning, sometimes you think, oh, it's just a ballpoint pen. How can I be affected by a ballpoint pen given by a pharmaceutical company? I can easily buy a lot of ballpoint pens. But the fact is, according to those researchers, that even when the stakes are small, you get affected, and actually limiting gift size is not likely to eliminate bias. And individuals are not aware of their bias even when they are told about it. So what's the whole point here? My point is to show that the good guys, and I'm referring to us here, the good guys are not always as good as we seem to be. We have to accept that. We have to accept that we could be affected by our own biases, by conflicts of interest, even when we don't realize it, even when the stakes are small. The fact is that we are not always as objective as we think we are when we make decisions. And we all need to be reminded. Okay? If we're not always as objective as we think we are, then we need other people to remind us to be objective, to remind us that we may sometimes not be thinking correctly, or that we may sometimes have to have others review the decisions that we make. It does not mean that we are being bad. It means only that the way human nature is, we could be affected by our biases, by things going on around us. And if we are reminded by people around us, it doesn't mean that we are doing something necessarily bad. It is just that we get affected because of the way we are as human beings. Okay? So we don't necessarily have to feel bad or to feel that we are so evil persons when others around us remind us that sometimes we are making mistakes. Okay? So you have just to review the nature of conflicts of interest, you have a conflict of interest when you have a primary interest, but there are secondary interests that get in the way. And by primary interests, we mean the things that we ought to be concerned about, like valid and useful research output, or the welfare of our patients, or general welfare. On the other hand, there are other things that could get in the way. There are other things that are equally interesting for many of us, like financial gain. In the case of sponsors, profit. In the case of the investigator, maybe bonuses, rebates, consultancy fees. Or in the case of the institution or a laboratory, research grants, equipment, or administrative fees that can be collected. Or there are also non-monetary secondary interests like recognition or promotion, prestige, and pride. These are things that are so important for us. Sometimes we may sacrifice or we may consider sacrificing the patient's interest or the general welfare when these are so interesting for us. And then there is a matter of systematic bias for a company sponsoring research. And it has been pointed out that there could be a tendency, for example, to choose when comparing drugs in clinical trials, is to choose an inappropriate comparator for a study, or to show some bias in the reporting or in the publication of results. And we'll have some example to mention here. And this example arose in the case, or in this case, because of, or through the use of ghost writers. Some time ago, there was news about medical papers being written by ghost writers. And the idea then was to try to push for the use of hormone replacement therapy. Well, since then, as many of you will know, hormone replacement therapy has been shown to lead to cancers. But during that period, it became fashionable in a way because of ghostwriting. What does that mean? For example, JAMA published this article about guest authorship and ghostwriting in publications related to rofecoxib. And the description of how ghostwriting takes place. You have a review manuscript that is prepared by unacknowledged authors. In this case, the unacknowledged authors were actually people working for the pharmaceutical companies involved. So who was doing the writing? Not the authors who were named, but people working for the pharmaceutical company. And subsequently, they attributed authorship to professors from academic institutions who did not disclose that they were also being paid consultancy fees by those pharmaceutical companies. So what we need to do in those cases is, of course, to be more transparent, in this case in the matter of declaring authorship of publications or papers. But this is just one of a number of forms of scientific misconduct, and here in this paper, we have a listing of showing how extensive scientific misconduct could be. And a survey of, for example, if you note the last line here, students willing to fake data, they say 1 out of every 2 students, according to this survey, would have been willing to fake data. And here is another list. I mean, I'm asking, what do we refer to when we talk about scientific misconduct? And here is a list, and I particularly want to call your attention to the last item here, number 10, that talks about changing the design, methodology, or results of a study in response to pressure from a funding source. And look at the percentage, 20.6. This survey refers to a survey of researchers themselves, okay? Medical researchers or scientific researchers. So the researchers themselves, responding to questions, said 1 out of 5 of them, that's 20+%, 1 out of 5 of them said they, in the last 3 years, had changed the design, methodology, or results of a study in response to pressure from a funding source. Now, suppose the funding source is a pharmaceutical company. Then you have 1 out of 5 researchers admitting that they have modified data, that they have misrepresented data in order to show the results that the company they were working for would be pleased. 1 out of 5. That's a huge number. And if we're talking about drugs, for example, in the case of clinical trials, what does that tell us about the quality of the drugs we are using? That's not a good commentary on how reliable the information is, isn't it? And then these are, here are these other items. Publishing the same data results in 2 or more publications and so on. So you have different sorts of items here. And look at the percentages. The middle figures refer to mid-career professionals or researchers. These mid-career researchers are actually those who are at least 9 years in the profession at that time. And so you have at least 12% here who would be guilty of any one of these. So that means at least 1 out of 10 would be guilty of these different forms of misconduct. Again, that seems to be a huge number, isn't it? I mean, we were talking about truth being at the foundation of scientific inquiry, and yet we're being told here 1 out of every 10 of these people whom we trust, and that includes us, 1 out of every 10 during mid-career would have done these forms of misconduct. Isn't that alarming? And overall, this is the paper we are referring to. We're talking about scientists behaving madly that was published in Nature in 2005. So what are its conclusions? Overall, 33% of respondents said that they had engaged in at least one of the top 10 forms of misbehavior during the past 3 years in their careers. Among mid-career respondents, this proportion was even higher at 38%. So that's, you will agree, is very high. And one of the things, now I call your attention to number 12 here, which is inappropriately assigning authorship credit, because we were talking about ghostwriting earlier on. So just to illustrate some more, I have this case study, and let's go through it together and see what you think. This is about a surgeon who is expected to contribute tissues to be used as samples for a research project. Let me know if this sounds familiar to you. He knows one of the expected outputs of the research team is a publication reporting the outcome of the procedures involving the collected tissue samples. His contribution is essential for the success of the project, and he knows that very well. And the other people in the project also know that very well. But he has not been involved in the project from the beginning. He was only engaged when the project was already ongoing, and he was asked to contribute those samples. So he was not one of the planners of the project. He is not one of the listed investigators. He was just invited later on. But he requested he be listed as an author of the article. And the question is, should Dr. S really be listed as one of the authors? Let me know what you think. Do you think he should be listed as an author? What do you think? Do you want to share with us what you think? There are microphones somewhere scattered on the tables.
How the surgeons get the tissues.
What do you mean? It depends on how.
That means that if the tissues come from an elevated work, so maybe
Comes from what? Sorry.
he has to do a lot of work to collect all the tissues for the whole research team. So I think maybe in this case, I believe that he can be put on the list of the author.
Mm-hmm. So you're saying he perhaps should be listed as an author because he does a significant part of the work.
To collect the necessary tissue for the research team.
And that part of the work is necessary for the completion of the project. Did you?
Yeah, this is Dr. Zhang from Caltech General Hospital. In my point of view, I think that what matters is that if the procedure is newly designed by Dr. S, he designed a new procedure to get this tissue. I think he deserves the title for to be listed as the author. But if he is just doing some simple routine procedure, he is just one of the contributor to this large study. He's been used as a screw from a machine. I don't think he deserves the title. So I think the most important thing is that the procedure. If that Dr. S is the responsible for this whole new procedure, I think he deserves it.
So it is this response is a bit of an elaboration of the earlier answer. I mean, an elaboration in the sense that perhaps you're saying, perhaps we should clarify the exact nature of the contribution, because while it may be an important contribution, it may be something that a lot of other people can do. Yeah? Is that correct? In other words, it is, maybe it doesn't even have to be a surgeon doing it in this particular case. It's just that tissues have to be contributed, and the nature of the contribution could be such that it doesn't require a special person to do it. Yeah, as a matter of fact, well, in one of the forums where this kind of example was discussed, somebody pointed out, well, what if what if aside from the surgeon, there is actually someone else who is required to be present with a refrigerated bag, so that the tissue excised by the surgeon could be properly placed in this refrigerated bag or in this ice bag, and the ice bag has to be brought to the laboratory within so many minutes, because well, otherwise it wouldn't have the necessary quality for this study. So you have another person required whose work is absolutely necessary. He has to be there at this precise time, and he has to be able to bring the tissues to the laboratory at this precise time. That is also indispensable for this project, but you will not want to credit him with authorship. So that, well, okay, so you don't want to credit him with authorship, but this point now tells us, but this is not just being indispensable, this is also being or having a kind of expertise that is necessary. So it's not just someone who can do it, but someone who can do it in this particular way. So important as it is, then he has to be an author. Who doesn't agree? Is there someone who doesn't agree? It's difficult to disagree with a surgeon, isn't it? Yes?
I agree with your statement that it's still very vague to differentiate about the contribution. In the third point, you say his contribution is essential for the success of the project. What kind of success? Or in a lot of cases, we cannot. The delivery of the tissue to the in a very limited time, then perhaps that contribute to the success of the project. I think probably in the next your slide there's the authors should contribute to the intellectual contents of the paper. Could be the criteria to improve that one to be an author.
Okay. Okay. We move on to the next slide now. Well, but first the point about the contribution. Now we were saying, well, the surgeon makes a very important contribution that is essential for the success of the project. So when we want, and those among us who want to credit this particular surgeon with authorship, want to do that because we want to acknowledge how important the contribution is, right? It is important. It is not the same as the contribution of the person who runs with the ice bag to the laboratory afterwards. He has the kind of knowledge that the ice bag person doesn't have. But to acknowledge those things, to acknowledge his expertise and his knowledge, is that the same as being qualified to be an author? And to answer that, we move on to these points. And here we're referring to the uniform requirements of the ICMJE. As some of you might know, the ICMJE is an international committee of medical journal editors. And the International Committee of Medical Journal Editors has come up with this document that is widely regarded as the set of guidelines to observe in recognizing authorship. And what do they say? For someone to be recognized as an author, a person must contribute substantially to one of the following: conception and design of the project, the acquisition of data, or the analysis and interpretation of data. One of those. Okay. Plus, so there has to be one of those three, plus drafting the article or revising it for intellectual content. And third, final approval of the version to be published. So there are three requirements. The last two plus one of the three listed under the first one. And if you look at those criteria and ask about the surgeon whether he qualifies as an author, the answer is that he doesn't qualify. Right? Okay, so he wouldn't qualify as an author, but we wouldn't feel so good about it, would we? Right? I mean, it doesn't seem to be fair to the surgeon because of his important contribution to the project. It doesn't seem fair to him that he would not be listed as an author. Agree? Who doesn't agree? I think we agree on that, right? It seems that we would be unfair to him if we do not name him as an author. So what would be the solution? Do we just disregard the ICMJE requirements? My point here is, if we just disregard the ICMJE requirements, then we would in a way be lying. We would not be truthful, because when someone is declared to be an author, the expectation would be that he contributed in these important ways. So the suggestion is to involve the surgeon as collaborator from the beginning. I mean, the point is that, well, if you're thinking of a project like this, you are expecting that there has to be a surgeon at some point to contribute in this way, then you should be able to anticipate also that the surgeon should be involved in the planning, and therefore make him qualify for authorship by fulfilling those authorship requirements. What I'm saying is that there should be no shortcuts to this. We can avoid lying by getting him involved in the other ways as well. Does that sound like a practical suggestion? I mean, I'm just trying to be consistent with the original point here. That scientific research, scientific study is about the truth. It is about the search for truth, and as much as possible, we should try to comply with the requirements of truth-telling at all times. Authorship is about, well, many of us will focus, when we think of authorship, on the contribution and the credit that goes with it. And many of us will seem to forget about the other side of the coin, which is responsibility. So I'll try to explain next why it is important to be truthful, not just because truthfulness is important, but there are other reasons as well. And here, I give the example of Malcolm Pierce. He was at that time senior obstetric consultant at St. George's Hospital in London. What Malcolm Pierce did was to tamper with computer records in an attempt to create a fictitious patient. And this was his claim, that a 29-year-old African woman had given birth to a healthy baby girl after he, Pierce, that is, successfully relocated a 5-week-old ectopic embryo via the cervix. So at the time that the claim was made, this was supposed to be the first of such a kind of relocation of the ectopic pregnancy. Well, he was so creative because he wrote an article reporting this, but he also tampered with the computer records to show that there was such a woman who was a patient at the hospital. It's difficult to imagine that someone like that could do such a thing. He also published a paper about a 3-year double-blind randomized trial in which 191 women who were prone to miscarriage were treated with human chorionic gonadotropin and placebo. So a comparison between these two. And he was supposed to have been able to conclude from the randomized trial that human chorionic gonadotropin improved the outcome of pregnancy in women with recurrent miscarriage and the polycystic ovary syndrome. Very creative indeed, wasn't he? But the case that he described in the first paper didn't actually exist. Okay? There was no woman as described in his paper. And the trial described in the second paper had never taken place. So there was no such trial. And he even named a pharmaceutical company, but that pharmaceutical company also didn't exist. Can you imagine publishing those papers? But even more surprising is the fact that the papers went through peer review and were passed by the peer reviewers. Okay. So it wasn't as if somebody just made up the story and then by his own effort published it. It was published in a medical journal, and the medical journal sent the papers to a peer reviewer or peer reviewers, and the peer reviewer said, okay, it's good. Now, obviously, if you do something like that, you would have been dismissed, as he was, from his post, and his name was erased from the medical register. Okay, so he couldn't be a medical doctor anymore. But here is the main point here. Professor Jeffrey Chamberlain, head of the department, had to resign from his post. Why? Well, he had to resign because he was named as a co-author. So this is what I mean by talking about credit, but not being aware of the corresponding responsibility. So this head of the department, because he knew Pierce, he knew Dr. Pierce, when Dr. Pierce said, I will name you as a co-author, the chair of the department said, oh, that's good. That's another publication added under my name in my CV. And that's good for you and good for me. But it's not so simple, because if you just accept gift authorship, not being fully aware of what went on during the study being reported, then this is what could happen. So he also had to resign. So authorship is not just about credit, it is about responsibility as well. And later on, Professor Chamberlain was going to say this paper was peer-reviewed twice, both medically and statistically. So you can imagine how good Pierce was, even with the statistics, because he just made everything up and made everything up to show good statistics as well. And it never occurred to the referees that the whole thing might be a lie. Okay. Now the next point is about what someone may refer to as necessary deception in research. But isn't it the case, the question here is, isn't it the case that sometimes we do have to practice some kind of deception? So let me describe to you the case and ask you what you think. This was a study to determine or to examine whether and how women in the sex trade in a particular community negotiated condom use by their male partners. The point was to help reduce the incidence of HIV/AIDS in the population. And Dr. J, who was a medical anthropologist, was concerned that if women were to be asked directly, they might not answer questions posed to them truthfully. Thus, the study involved participant observation that was going to involve deception. So here was their plan. They were to pose as male customers who casually met women in one of the venues to negotiate for sex. They would then ask the women how and why and with whom they bartered casual sex. And the idea was for them to know how women were able to convince, or otherwise, their customers to use a condom for protection. But they would soon find a way to escape without engaging in sex. Now, the ethics committee thought the methodology provided a good opportunity to gain valuable insights that would also provide a good basis for policy making later on. But they said to compensate for wasting the women's time, they had to be paid. Okay? So the men researchers were not going to engage in sex actually. They would have excuses for not continuing with sexual bargain, but they would still pay the women. So that was the innovation suggested by the ethics committee. However, later on, the peer reviewer objected to the publication because the peer reviewer said, oh, but you are engaging in deception. Because this is founded on deception, then you cannot publish this work. Now, what do you think of the view of this peer reviewer? You think that's a valid point to make? Will you just abandon the idea of publishing your work or publishing about your work because a peer reviewer says, oh, you cannot do that. You cannot be deceptive. Is that not one of those examples? Remember, we had a slide earlier on that says, are research ethics bad? Is this one of those cases? Who thinks the deception in this case was justified? Was it justified? How would you justify the deception? Okay, if I were the peer reviewer and I say, no, you cannot publish because of the deception, and you're talking to me, how would you justify what you did? How would you explain it? Having gone through all the trouble, it would be a pity if this were not to be published, right? But how would you justify, how would you explain? Who has some idea? Any suggestions? Yes?
Probably the board will be formally inform the partner that is taken into this test. We want to formally tell them what they are going to do is to question about how they feel and blah blah blah. So those questions, and formally have them sign a paper that they agree to answer the question willingly, and they are so willing to let them use their answer as a database. Well, that is all IRB are about, right?
Are you suggesting that this be done after the research?
No, before the research.
Okay, before the research, but what what they wanted to avoid, what the medical anthropologist wanted to avoid, was the women knowing what the questionnaire was all about,
Sure.
and therefore anticipating what the interviewer would have wanted to hear, and
Sure.
therefore the interviewer wouldn't be getting truthful results.
Yes, hopefully those women will be so willing to tell the truth how they feel about those questions. But the investigator here is obviously do not believe that these women are going to tell the truth. So they want to do this specific procedure, right? So on the other way, if we want to do it right and always tell the truth, that's the key point. If we want to always tell the truth, maybe it would be better before the trial. We want to correct all these women and then tell them what we're going to do. We want to ask so many questions. They want to answer so truthfully from your heart. And that is going to be used as a database for this analysis. And they all sign, yes, I would take part in this test. And that counts for this publication.
Okay, so the idea is to approach the women beforehand and explain to them how important this study is, and therefore to convince them to tell the truth. Okay, please, this is how someone might approach them. Well, we're sorry we have to do this, but you will understand how important this is. We want to minimize the bad effects of this practice on the rate of HIV infection in this area. So you will understand the importance of telling the truth. Okay? So that's what we expect you to say. That's what we want to hear from you. Please cooperate with us. Okay? And then you get them to sign an informed consent form, so you comply with the ethics requirements.
I think that's all academically right to do it this way, but there is something can get into between the tester and the one being tested. For example, not too serious, it's just for example. If the tester is a handsome boy, luring the woman to have sex with him, and then in the meantime, he asks the woman, would you like to use condom during the sex? Maybe the woman will say, no, I'm so willing to have sex with you without any protection, without any condom protection. And that is going to influence the answer. If the woman does know that we are going to investigate a formal academic paper, maybe I would like to answer, yes, we have to use condom all the time to protect, to help eradicate AIDS or such disease. But if that woman is all lured by the handsome investigator, maybe the answer is quite different from she thinks really is correct.
Okay.
I'm not sure if that really answered the question.
Yeah. Do I understand your point to be this, that even if they were just to proceed in the ordinary way, they would not actually be able to expect necessarily truthful answers, because the answers would still be affected by other factors. And this is one of the factors that might affect the answers, like how good male customer looks would influence the way the sex worker answers, right? So there's no guarantee. You're telling us there's no guarantee that you really get the correct answers. I can imagine that the medical anthropologist will reply to this objection by saying, well, one way to deal with that is to balance the appearance of your researchers, so that some of them will look good, some of them will be ugly, some of them will be tall, some will be short, and so on. So statistically, you would have differences between the appearances of these persons. Yeah, any other ideas? I think those are important points, but at the same time, well, we're trying to balance two things, right? One is the need to be able to get at the truth, and many health researchers in the field of the social sciences, medical anthropology, medical sociology, actually tend to rely on deception. It seems to be something necessary or even essential, some people think, right? So how might you be able to avoid it in this case, if you can? What might you suggest? Is it acceptable, instead of going to them before, to go to the women afterwards? In other words, okay, now I'm the peer reviewer, I'm saying you cannot publish because of the deception, and then you tell me, oh wait, well, what about we go back to the women, we tell them, look, we conducted this research, and we were being deceptive when we did it, but now we have to tell you the truth. Will you forgive us? Well, even in social science research, you have what is called debriefing, right? So debriefing means after you sort of lie to the research subjects, you go back to them and tell them, well, we lied to you, but we have a responsibility to tell you the real truth, and this is what happened. Will you forgive us, and will you now sign this consent form? Would that be okay? Yes.
If someone do lie to me and then come back to me and say, would you give us? I will say no. I'm sorry.
So it wouldn't work. So can someone think of a way to deal with it? What if we have a slight variation on what he suggested earlier on. You tell the women that you are going to approach them with a questionnaire, well, not a questionnaire form, but with some questions. But when you do, or when your staff do, when your researchers do that, they won't identify themselves. You tell them, okay, in the next 60 days, in the next 2 months, we are going to do this research. And what this research involves is telling you this or asking you these questions. Okay. But in this case, the difference is you're not telling them exactly when, because you're telling them in the next 60 days. So even if they anticipate that one of your researchers might be coming, if that happens in one of those 60 days, then it will be difficult for them to lie or to try to construct answers in a different way. Do you get the idea? Or someone, for comparison, let's look at a different example. I want to do a research among physicians in their offices. And what it involves is to rate the physicians according to a scale on how friendly or unfriendly they are to patients. Okay? So, I'm going to send people to pretend that they are patients in order to have themselves treated by doctors at their clinics. Now, what I'm going to do is to tell the doctors, doctor, this is the research that I am conducting, and this will take place in the next 60 days. I won't tell you who my researchers are, but they will pretend that they are your patients in the next 60 days. Okay? So may I have your consent? And the doctor says, yes, okay, and he signs an informed consent form. Would that be okay? So there is a bit of deception, but it is a kind of deception that the doctor will also consent to. He gives his informed consent for it. Is that okay? So if that's okay, then it's okay also with the women. Sounds like it? So we were asking earlier, well, if you don't proceed with the research, then in a way, ethics review is being a bit unethical, because these are important findings that you wish to have, right? You want to be able to reduce the incidence of HIV among this population, and that's a good thing to do. But if you can't do it, then you're a bit being unethical by not doing it. But the reason why we're trying very hard to find ways to do this correctly is that we don't want to promote the activity of lying. Sisla Bok was actually, or is actually, the wife of Derek Bok, whose article about teaching ethics we mentioned earlier. And as she has said, trust and integrity are precious resources, easily squandered, hard to regain. They can thrive only on a foundation of respect for veracity. So in this, in the example that we mentioned, we don't really want to prevent research altogether. What we want rather to do is to prevent research done unethically. And preventing unethical research will be just an intermediate step. What we want to do is, after preventing the unethical research, to proceed to find ways of conducting the same research ethically. Okay? Sometimes, as members of IRBs or institutional review boards or ethics committees, we love the power so much. When we see something as unethical, we want to stop it. But we stop right there and do not go out of our way to try to achieve what the research seeks to achieve, which is also not good. Because if you have a good objective for the research, then we must try to find ways of carrying it out, but in an ethical manner. I feel that when we serve on an ethics committee or an institutional review board, our responsibility is not just, or does not end, our responsibility does not end with preventing unethical research. I think we need to go one step further. The responsibility is to prevent unethical research, but also to enable similar research or even the same research to proceed, but in an ethical way. That is why we went through pains to find a way to make that example of a research project move forward. Okay? And the suggestion was that in that particular case, you find, you tell the research subjects beforehand what you're going to do, but make sure that when you tell them, you do not affect the possible answers that they might have. And it is actually one of the accepted methodologies for social science research in health, that you approach your subjects beforehand, tell them that in a way you're going to lie to them, but that the lying is limited to this point. Okay? You don't know when you're going, you don't know who is going. Okay? So, because when you lie about a few things, a few items. So you're trying to reduce those things. Okay? And then, afterwards, you also have to debrief. When you debrief, you tell the whole truth. You see, we went to you on this day, and this is the person who came here and did the interview. Okay? You can do that afterwards. And then people will be even more willing to participate in research of that type. Do you have any questions about the examples we gave? So the point there is to be creative and try to find non-deceptive alternative methodologies. Okay, and then what is this point about? People who are talking about the Asian context in informed consent or for informed consent often make the observation that consent in the Asian setting or in the Asian context is very different from that in the Western context. For example, there is someone who says, well, you have to distinguish between individual consent and family consent. In Western societies, when you want to get consent, you talk to the individual patient. Okay? It is the individual patient's decision that has to prevail. Okay? So you have the patient in the hospital, you have the patient in the hospital and you want to be able to perform this procedure, you have to explain this to the patient, and the patient himself will give you the consent. Okay? That individual patient. Now, in the Asian context, we say, oh, but that doesn't seem to apply. You probably heard this quite often. As a matter of fact, what you do is to talk to the relatives and don't tell the patient at all. The relatives will tell you, please don't tell the patient. What you don't know is that the patient has also spoken to the doctor and said, please don't tell my relatives. Sometimes it also happens, right? So it happens both ways. But anyway, the point is, at least in the Asian context, we think that giving consent is a family affair. It is a decision that is made by the whole family with some qualifications. Okay? But well, I just wanted to focus on the idea that very often we're protective of the patient as relatives, and we say the truth could harm the patient, so don't tell him, and just explain to us and we will make the decision. Now, what is this saying? Cecil Bock is saying, but look at the empirical research we have done. Actually, there is no evidence that patients in general will be debilitated by truthful information about their condition. She is telling us, oh, you worry too much about what the effect of the truth will be on the patient. Actually, they might appear to be affected, of course. When you surprise them with the truth, they are going to be affected because they thought they were not dying, and then you tell them they're dying. If you tell someone that he's dying, then there will be the surprise element. And when, as you speak, you'll see what the effect is going to be. But the research, according to her, research shows that actually beyond the immediate effect on the patient, which you see because you're surprising him or her, aside from that, there is no truth to the claim that this condition will deteriorate. So you don't necessarily have to lie to the patient about it. What she's telling us is there are so many instances when we say to ourselves, we shouldn't be truthful, we should hide the truth. We find so many excuses for not telling the truth, but those excuses are very often just made up. Now, there are, of course, also a lot of examples of deception or lying by falsification or fabrication. And coming from myself, coming from Singapore's National University, I find it a bit embarrassing to be talking about this example of Dr. Melendez, who has recently, just this past couple of weeks, been in the papers for research fraud. And of course, the university is right in saying, well, our reputation as a university has not been tarnished despite this fraud perpetrated by one member of the faculty. And it is important that in order to avoid the reputation of the university itself being tarnished, that it show the world that it is doing what it can in order to investigate and to bring this person to justice who perpetrated this fraud. But look what is happening. You see, let me go back to that one first. You see the headline there, it carries the name of the university. It doesn't even mention in the headline, in the title, the name of the person, although his picture is there, but NUS is there. And again, you have it there in the title. Here again, you have the name of the university. And that's another account. And eventually, his papers have to be retracted, meaning the publishers of the papers have to withdraw. Aside from that, you have news items like this. My point is that when someone commits a fraud of this nature, the fraud tends to reflect, even if unjustifiably sometimes, it tends to reflect not just on the person committing the fraud, but in the previous examples, on the university that it comes from, and sometimes even on an entire country, here mainland China in this case. And we even have an example in this case of someone who was Vice Chancellor of the University of Monash at that time. The Vice Chancellor of a university in Australia is actually the head of the university. Here I think Vice Chancellor means something else, right? But in the case of Australia, the Vice Chancellor is like the president of the university. So this person was president of Monash University when his plagiarisms were uncovered. It turned out that before he became president of Monash University, he had actually plagiarized twice already. And when he was president, there was another plagiarism that was uncovered. And so you have news items like this. Okay? And evidence suggests that between 10 and 15% of academics are plagiarists, according to one study. So this was another account. And we can call attention to this particular point again. The whole academic project depends on honesty. How else can the public trust the results of research? And here's another example of another form of misconduct by someone who was actually a Nobel Prize winner. Can you believe it? Robert Millikan was awarded the Nobel Prize in 1923 for what he did as part of an oil drop experiment. He did this research in 1913 and got the prize in 1923. And he was a bit lucky that it wasn't until 50 years later, when he was dead already, that the misconduct was uncovered. It's difficult for me to explain how he did it, but basically the idea is this. He was supposed to be observing something about the drops of oil I mean, something having, this was a physics experiment. Let me try to describe it as well as I can, while obviously admitting that I'm not a physics person, so I cannot describe it in a way that will be acceptable to a physics person. But he was supposed to observe some of the properties of oil drops He was supposed to observe the properties or some of the properties of oil drops, and what happened was that some of the oil drops didn't show. Some of the oil drops didn't come up, or in some of the measurements, he didn't come up with what he expected. So what he did was to just select the measurements of some of the oil drops. You know, it's one of those experiments where you anticipate a certain result. If some of the results do not fit your expectations, you don't include them. Okay? If you've done that kind of study, you know what I mean. You observe the properties of certain drops. Some of the drops do not reflect the results that you expect, so he did not include those drops. And then when the curve was looking good, he chose these drops and included them in the calculation. He did not include about 1/2 of a total of 100, more than 100 drops. He only included 1/2 of the total because the other half would have changed the results. Okay? So he published his paper and he won the Nobel Prize. 50 years after, someone looked through his notebooks, okay, examined his notebooks, and lo and behold, in the notebooks he was saying that there were these drops that I did not include. Okay? So he was dead already when somebody else went through those notebooks, so he couldn't be embarrassed anymore, he couldn't be ashamed, but maybe his grandchildren were, and maybe it would have even been worse, right? So 50 years later, the 58 observations presented in his article were in fact a selection from a total of 140. So many of those he did not use. And what about Wang Wusuk? Wang Wusuk, how many remember Wang Wusuk or are familiar with his story? Did you remember his name before? No. But you remembered he was Korean, right? My point is, again, you see, you're doing your country a disservice. People will not remember your name, but they will remember what country you are from. If only for that, you should be fully ashamed of yourself if you do these things. So, what he was widely regarded as a stem cell rock star until he was disgraced because he had to admit that he committed data fabrication. And look, it was afterwards being described even as a crime, okay, a science crime. So if people talk about your work as being the most spectacular forgery scandal, you must really be ashamed. in the history of science, they say. What did he actually claim? He claimed in one article in 2004 that his team was the first to clone a human embryo, and that they derived stem cell lines from the cloned embryo. And then a year afterwards, published another paper that they created human embryonic stem cells genetically matched to specific patients. The idea was that if you could match the genetically engineered embryonic stem cells to particular patients, that you would then be able to treat patients with the particular sources of the eggs or the cells with these cells, the same sources later on, without rejection, because this came from them. Okay? So this is supposed to be the basis of cell banks when you get from cord blood cells. Is there a cord blood cell bank in Taiwan? The claim by some is that, well, you pay to have the cord blood cells of your children in the bank, so that if something happens to them later on, you can use the cord blood cells for their treatment in some way. I'm not going to criticize. I'm critical of that, but I do not wish to debate at this point with anybody now. But the general idea is based on this. So what did the investigating committee establish afterwards? The genetic material of the supposedly cloned human cell line did not actually match that of the donor, which means it wasn't derived as they claimed they did not match any of the stem cell lines from the IVF embryos. So they were just fabricating this thing. The images and data in the paper that showed perfect matches were fabricated. And all the suspicion started actually because of the claim that they paid egg donors or coerced junior researchers. In other words, in their own laboratory, they had junior collaborators who were women, and some of those women were paid to contribute some of the eggs that they used. And initially, the criticism was based on the idea that this was against their bioethics laws. They had just passed bioethics laws saying you cannot pay for eggs. It would have been illegal to pay women for their eggs. But let me narrate to you a direct observation that I made, because I was during the time when this was just being discovered, I was vice president of the UNESCO International Bioethics Committee, and I was invited to South Korea just that same week to be on a panel with Huang Wusok to discuss the ethical issues. So I was so excited because I had heard a lot about him. He was supposed to be a rock star indeed, and just to be on the same panel with him would have been an exciting experience for me. So I canceled some appointments to be able to make it to that invitation. But when I got there, actually, the news had come out, and during the program, Wang Wusuk wasn't going to appear anymore. So you can imagine how disappointed that I was. I was prepared already to brag to my friends. I was in the same panel with Wang Wusuk. See, but what did I see in one of the hospital where he worked? During the time that he was already being criticized, a long queue of women waiting to have a chance to donate their own eggs for his use, for his research. See, some of the newspaper men were criticizing him already, saying, "Oh, you're a fraud, you're a cheat, you're telling us you did this when actually you didn't." But because he was a rock star supported by government, these followers were still believers in him, and they would not believe that he was a fraud. They were in long queues, really long queues. Can you imagine women falling in line, waiting for the chance to donate their eggs? I mean, and it's not easy donating an egg. I mean, it's not as if you put it in your pocket and leave it there. You know, it's an invasive procedure that is required for you to be able to donate an egg. And these women were so convinced of how good it would have been to contribute to the advancement of knowledge. But I have a partial explanation for why it happened. Aside from the fact that he had government support, there is also the idea of translational research. I'm sure that you would have been, you would have heard of, that you would have been the object of lectures or promotions telling you, if you are to engage in research, don't forget the translational elements. We have to bring the results. Okay? We have to move quickly from bench to bedside. Okay? We have to be able to use the results of research for the good of the patients. A good thing, isn't it? Right? Now you're waiting. You're waiting for me to say it's not a good thing, but it's a good thing. I say it's a good thing because that's what we want to be able to achieve, for medical research to be useful to patients and to be useful quickly. From bench to bedside. But there is a third step here, which is to the bank. Okay? Because other than bringing the outcome of research to the bedside, there are also those who are interested in the banking aspect of it. See? I'm not saying that is bad. That in itself is not bad, but it could have bad effects depending on how we implement these things. It was later on found out, for example, that in the case of Wang Wusuk, he had at least 7 patent applications related to cloning or stem cells, even before the publication of the 2005 paper. And not only, well, of course, when you have a patent for something, especially in this case, someone observed the patent holder for creating embryonic stem cells from cloned human embryos could earn a fortune if the technology works. Okay? So while there are bound to be a lot of gains for patients, there are also a lot of material financial gain for some people if they play their cards right. That in itself, again, I want to emphasize, that in itself is not bad, okay? Not bad in itself. But if it takes precedence over helping patients, then it is bad. And more so is it bad if it takes precedence over the truth. In other words, if people make money at the expense of the truth, meaning even when there is no there is no benefit to patients that can be really proven. But not only Huang Wusuk, but also some of his partners, co-authors in the published articles, Gerald Shetten and Pittsburgh scientists Calvin Simmerly and Christopher Navarra. They filed a U.S. patent application in 2004 for methods that would make human cloning a practical procedure. So what I'm saying is, at the same time that we are focused, or that we focus our attention on the possible beneficial applications of research, at the same time, the researchers themselves were focused on the money component, because this would have given them a lot of money for the use of the procedures that they had patent claims for. Okay. And some observers were pointing out these methods could also be used to derive embryonic stem cells to treat disease according to the application. So you would have seen a lot of news items recently about using embryonic stem cells for cures, but those could have had to pay royalties for those who showed success in their earlier researches, if those researches were shown to be correct. So what we see is that there is a difference when, in the case of translational research, the focus is on desired outcomes rather than on what the evidence actually dictates. So these people had their attention based on what they wanted to be able to prove. So just a few lines here to move to our conclusion. Deception is worse than coercion. Some people, Sislabok reminds us, it is worse than coercion because in the case of coercion, when you're being coerced to do something, you know that you're being coerced. You could feel the coercion and therefore resist it. But when you're being deceived, you don't know that you're being deceived, so you could not resist it because you wouldn't know that you have to. And the suggestion has been made in this presentation, when tempted to deceive, to look for alternative honest ways to get results. And we have been reminded it is useful to have review committees for independent oversight and advice. But let me emphasize here, we talked about teaching ethics. Let me emphasize the idea of a hidden curriculum. Teaching ethics could be done using lessons in a classroom, but it wouldn't work so well because what is important is the example that we set in matters of ethical behavior. And one may suggest, in the case of responsible research, the creation and cultivation of an atmosphere of transparency and integrity. In the case of authorship, it is important to have clear policies about sharing of credit and responsibility. In your department, it will help if you want to publish papers, you know from the beginning who is going to be a first author, a second author, because you have the policies clearly laid out. In the case of conflicts of interest, again, you have clear rules about disclosure. And in the case of laboratory records, also the responsibility for storage, maintenance, and access of the records that are supposed to be there, the laboratory notebooks, as in the case of Robert Millikan. And in relation to all of these, there is the importance of mentoring between the senior faculty or the senior staff and the junior staff, so that everybody could be comfortable with the requirements. And it is important also to make, I'm sorry, I think this is not in your notes because I only added this after I sent slides. Make compliance a habit rather than a painful task. But let me explain this last point to you by narrating to you a short story. This short story is about a young man in ancient Asia. And this young man, his father was a very good swordsman. You've seen all those movies with Asian swordsmen. This young man died. His father, or no, not the young man, the father died. The father was a great swordsman. And this young man, when the father died, wanted to become a good swordsman like the father. Now, during those days, when somebody wanted to become a good someone for something, he had to live with a teacher. Okay, so he packed his bags and went to the house of the teacher to become a good swordsman. At first, he asked the teacher, "Teacher, how long will it take before I become a good swordsman?" And the teacher said, 5 years. 5 years? It's a long time, isn't it? And the teacher said, in that case, it's going to take you 10 years. 10 years? At first you said 5, and now when I complain, you make it 10. And the teacher said, in that case, it's going to take you 15 years. And he was about to complain again, but he now realized he didn't want to take longer to learn. So I said, okay, what do I need to do? And the teacher said, okay, come in and live with me. So he went into the house and lived with the master who was going to teach him to become a good swordsman. And days went by, and the teacher wasn't teaching him anything. So he said, "Master, when are you going to start teaching me?" And the master said, "Have you eaten?" And the young man said, "Yes." "Then go and wash the dishes." Learn to become a swordsman by washing the dishes. But he had learned from experience how bad it can be if he kept asking questions. So he didn't. He just went and washed the dishes. And that he did every time after dinner. One evening, when he was washing the dishes, the master surprised him from behind with a stick. a stick to hit him. So the master surprised him, hit him with a stick here, behind. And it hurt very much. And he asked, "Why did you do that, master?" And the master simply did not pay attention. And so the master did it again another night. And another night, until the young man learned to be ready with his own stick. And the next time that the master surprised him with the stick, he surprised the master by protecting himself with a stick. And a few days more, and he had his practice until he became one of the best swordsmen in Asia. And that's the end of the story. But why the story? I think the story illustrates what I was saying about the hidden curriculum and teaching by example. See, learning ethics is very much like learning about swordsmanship in this way. It is learned by living together with someone who knows about it, someone who is a virtuous person, who can give a good example. And that's what we want to have in the clinics, in the laboratories, and in other areas where we work. And that's what we want to be able to cultivate, when people can make it a habit rather than someone that is forced by lessons. And this is the last slide, as you may know. And I hope indeed that there are enough honest persons in this room in order to make sure that we can have responsible conduct in research. Okay? Hope you have